Who owns the patient relationship? Marketing or clinical? I presented the marketing. Chris presented the clinical. The answer, as you would suspect, and again, we could really dive into this for hours and hours and hours, but it is both. There's multiple departments within marketing. There's multiple departments on the clinical side. All of them have to rise up, and I'm saying this very simply, I understand, but they have to start, quote unquote, air quoting, meeting with each other more often, understanding what that side is doing versus what the other side is doing at the lowest level possible. When this happens, what do you say? When this happens, what do you send? If you get this piece of data, what do you do with it? How many times do you follow up? What does it look like? How personal is it? How impersonal is it? Do you include clinical data? Do you not include clinical data? How is this related to what I'm doing over here so that we don't double up on the same message? Both have to own it. The big question at the end of the day is who's going to take the leadership of it and who's going to start bridging these two worlds together. Next one, Chris, please. And Chris is going to wrap it up for us.
Thanks, Gary. Yeah, so to take that further, and you hit the nail on the head just a minute ago, it's about partnering, right? It's creating, and it's easier said than done, we recognize that, but it's creating this symbiotic relationship really across many different dimensions. There's a technology dimension to this, which is the fact that, like, let's face it, you know, clinicians are just living in EHRs and population health management systems, and marketing is living in CRMs and marketing automation tools and content management systems and a variety of other things. But there's, you know, in today's modern day and age, it's, you know, we can pull these things together, leverage them, track things, interact things with one another. There's, of course, a strategy. There has to be intent. There has to be a desire and a willingness to say, let's orchestrate this. Let's work together on how do we engage our providers, educate our providers on the benefits and the, you know, how this is going to improve the net results we're going to get by doing this. And of course there's the coordination, and then, you know, there's always the inevitable resources side of this, whether it's your call center, whether it's, you know, your program management group that gets pulled together some cross-functional teams. One of the things we recommend is sort of using the lean startup principle or a lean approach, whereas you start small and you come up with sort of a minimally viable scenario, whether it's a certain service line or a certain practice or certain, you know, maybe a condition. Maybe you start it with flu shots. Maybe you start it with something really easy, right, that's low risk clinically, and you say, hey, let's just start piling out. How could we exchange information back with one another? And you learn from it. You know, you may fail on some things and succeed in others, and you take those and you move on.